So thanks for tuning in. This is Dr. Matt McKay, and we're here today to talk about something that we've seen become a real issue in our society over the last several years, and that is the mental health of college students. Nearly 20% of college students have seriously considered suicide, and over 7% have actually attempted it. And there's also a problem of self-injury, cutting, and other kinds of self-injury. Over 15% of college students have attempted that. And even more disturbing, perhaps, nearly 50% of college students have a diagnosable psychiatric disorder, 1/5 suffering from depression, and about 2/3 experiencing overwhelming anxiety. And on top of that, and maybe because of that, severe drinking is also common, with over 45% engaging in binge drinking. So there's a lot going on in colleges these days, and that's what we're here to talk about. In the world of behavioral psychology, researchers are getting very busy testing the efficacy of evidence-based interventions like acceptance and commitment therapy, dialectical behavior therapy, and mindfulness-based cognitive therapy. So our guest today, Dr. Jacqueline Pistorello, is the editor of a new volume called Mindfulness and Acceptance for Counseling College Students, Theory and Practical Applications for Intervention, Prevention, and Outreach. And the book illustrates how these various mindfulness and acceptance-based approaches are being utilized with college students. Dr. Pistorello is a research and clinical faculty member at Counseling Services at the University of Nevada, Reno, where she's worked with college students for over a decade. And she specializes in the application of two mindfulness and acceptance-based behavioral approaches with college students, acceptance and commitment therapy, ACT, and dialectical behavior therapy, DBT. And she's been awarded multiple grants from the National Institute of Health to research the prevention and treatment of mental health problems among college students using both ACT and DBT. So thanks so much for being here with us today, Dr. Pistorello.
Thank you for having me, Matt.
And alongside Dr. Pistorello, we're also very lucky to be joined today by the founder of Acceptance Commitment Therapy, Dr. Stephen Hayes. Dr. Hayes is a professor of psychology at the University of Nevada, Reno, and he's the author of hundreds of scientific articles, including co-authoring 2 chapters in the Mindfulness and Acceptance for Counseling College Students book. He's also the author of nearly 30 books, including the groundbreaking Get Out of Your Mind and Into Your Life. His research explores the nature of human language and cognition and their application to the understanding and alleviation of human suffering. The Institute of Scientific Information has reported Dr. Hayes among the highest impact psychologists in the world during the years 86 to 90, and based on the citation impact of his writings. So thanks so much for joining us, Dr. Hayes.
I'm happy to be here, Matt.
I guess I want to just begin by asking you, what is it about the college experience today that makes students so vulnerable? We've talked about a number of very serious mental health issues showing up for students. What is going on there?
That's a very good question, Matt. And there are many people out there trying to figure this out. And at this point, it's only hypotheses and conjectures. We don't have specific data to back it up exactly why this is happening. Some of the folks highlight the fact that college is becoming just more accessible in general. So the population that is in college today is more representative of the population in general, which includes people with mental health problems. So that might be what's going on. But there are also other potential explanations. In a recent book called The College of the Overwhelmed, the authors highlight the fact that college marks a period of a lot of transitions and a lot of challenges. Folks may be away from their family for the first time. They may be exploring their sexuality. They may be subjected to living in very close quarters when at home they might have had a room to themselves. They're faced with a diversity in the students around them, both in terms of race and ethnicity, but also age, sexual orientation, culture, socioeconomics. And so it puts in front of them several questions that they have to figure out in a relatively short period of time. In the meantime, they have a lot of academic challenges ahead of them. And these days, college costs are very high. Like if you go to some of the Ivy League colleges, we're talking about thousands and thousands of dollars. But even in a state school, we're talking about a significant investment on the part of the parents. So the students feel a certain pressure to live up to their parents' expectations and to do well in school, given all that. So these are just some ideas about why this might be happening. So there are a lot of stresses, a lot of challenges, and a lot of things happening at the same time.
Yeah, so college is a very challenging place for today's students. And I guess I'm wondering if there are also some unique opportunities for healing in the college environment.
Absolutely. That's the beauty of it. At least in the U.S., we know that 41% of the population will touch college at some level during their lives. So this is the last opportunity after high school for us to reach a large segment of the population in an environment that is really geared towards education and learning and improvement and so forth. So yeah, college is a great opportunity for us to impact a big chunk of the population at that time.
Another piece of that is that colleges have a direct interest in doing that. Part of it is their role, their learning role, but the other part of it is that with the pressures colleges are under, they know that they have to help the students in a number of ways, including meeting their mental health needs.
Yeah,
no,
in
I'm
fact,
wondering. Go ahead.
Sometimes the term in loco parentis is used for college administrators, this idea that parenting role that starts out with parents may be picked up by college administrators as well.
Yeah. So I guess I'm also wondering, why is the acceptance and mindfulness and the values work particularly important to improving the mental health of these college students? What does it offer uniquely that really helps them?
Some of this just has to do with changes that are happening in the world around us with our young people being exposed to stresses earlier and in a more intense way. And at the very same time that some of our social institutions and social support fabric is weak and people move around a lot more, the role of spiritual and religious institutions is weaker in many cases. And at the very same time that in your television screen and through all the screens that our young people are constantly in front of, they're seeing things that are horrific. So we sort of chopped and sliced and diced the culture at the same time that we've increased it. And so you've seen an overall increase in stress among young people. If you compare the amount of anxiety and stress that's visited among young people now, it's close to a standard deviation larger than it was just a few decades ago. And so part of, I think, why the acceptance and mindfulness and values-based work has taken hold here is in the context of a very busy and sort of under-supported world that exposes people early on to horrific and judgmental kinds of images and talk. You need to find a place to find yourself that establishes a greater sense of peace of mind and wholeness on the one hand, and meaning and purpose on the other. And that's exactly what the acceptance, mindfulness, and values work does.
Actually, technology probably has a lot to do with that, because if you go to college campuses these days, one of the greatest challenges for professors is to engage the students so that they don't text throughout the class. So mindfulness, this idea about bringing the attention to the present moment and one thing at a time and so forth, is particularly relevant.
Yeah, sometimes you feel like throwing their laptops out the window. So I was, one of the things that strikes me here is that the huge variety of symptoms that are seen among college students, and that one of the things about mindfulness and acceptance therapies that's important is that they do not target symptoms, but instead these underlying drivers for problems. And so I wanted to ask you to talk a little bit about the benefits of a trans-diagnostic common core processes approach to the problems of college students.
There's a couple of benefits. I mean, for the individuals that you're working with, it gives you a focus on a smaller set of things that have larger application, and especially if you're doing this with young people, you want them to have psychological skills that are useful to them when other things happen down the road that might be difficult, because we know that there are going to be problems going forward from this time. And for professionals as well, it gives you a focus rather than to have to put people into syndromal kind of labels and categories and then treat narrowly, only to find that later on you're going to have to go through something else if some additional problem develops. So the more trans-diagnostic and common core process approach is efficient in terms of training and focus of clinicians on the one hand, and it presents some hope in terms of long-term outcomes and prevention of the development of additional problems for young people if they're able to be reached with these processes early on in their lives.
So you're saying that an advantage for the counselor in particular is that you can address many different symptoms with the same treatment approach, the same core processes, so that you're not having to break therapy down into multi-pronged, many-directioned treatment processes. Is that correct?
Yes, absolutely. Because, if you think about most counseling centers work on a brief therapy model. If in the most recent College Counseling Center Director Survey, the average number of sessions was 6. If you only have 6 sessions to address multiple concerns, let's say somebody who walks through the door with anxiety, depression, substance abuse, it's hard to implement a different approach for each one of those presentations. So if we can have an approach that is based on a trans-diagnostic model, it would be very fitting to this brief therapy model that counseling centers operate under.
You mentioned flexibility, and I'm wondering how the flexibility factor of acceptance and mindfulness approaches really makes it a fit for the college community. What is it about that flexibility that's going to make these therapies more applicable?
Well, part of it is the changing world that they're in, that Jackie was talking about earlier, is that in rising up to these many kind of environmental challenges, but also psychological challenges, because of a developmental period that is characterized by a high rate of change. This is a different kind of thing where you really have to be able to bend with these challenges and go with the flow and find a way to move ahead. And so it's not by accident that we're coming down on processes that are useful across these mental health and substance abuse problems. But they're also empowering to other things. For example, we know that psychological flexibility is helpful in learning, because if you are in a class that's very demanding, for example, you're going to have emotions and thoughts that might get in your way when what you need to do is direct your attention towards what you need to do in terms of the studying. Jackie's done some work as well of looking at the correlates of people who study effectively and do well in school. And in some of the research work that we've done here, we've looked to see what happens over time in terms of things like dropout, being able to deal with things that come up, such as financial problems and academic challenges. And over again, we're seeing that the same psychological flexibility targets that are there in the acceptance and mindfulness work are applicable to these educational, financial, and environmental kinds of challenges, and these developmental challenges that characterize the college years.
It seems that we live in a culture that more and more tells us that we have to avoid pain, suppress it, numb it, push it away. If you're in pain, take a pill for it, smoke some weed, take a drink, do whatever you can to get rid of it. And in that environment, I'm wondering, is there something special that mindfulness and acceptance therapies has to offer?
Well, there's a piece of this which is, I think the culture itself has become more, in so many ways, in some corners, more experientially avoidant. And you do see it in the incredible rise of medication use for problems that used to be considered more routine problems that you need to deal with through patterns of healthy living. I mean, for example, minor sleep problems. Well, you look at what's happening with sleeping medications with tenfold increases just over the last decade, or attentional focus kinds of problems. You look at what's happened in the earlier years. People arrive sometimes in college having been on ADHD-type medications for many years, and in some parts of our society, the proportion of young children who are put on these medications is really staggering. And I think the overuse of antidepressant medications, which seems to be helpful at the most severe level, but then we're in an era where we have black box warnings of increases in suicidality, and in meta-analysis, it seems as though these medications are pretty clearly not that helpful when you're dealing with more mild, moderate depression, and yet they're overprescribed. So the culture itself has medicalized human suffering in a way that actually underestimates our capacity to learn how to deal effectively with these different behavioral and psychological challenges. Here we are at the early years where learning and development is the focus in the college years. And to expand out that vision so it's not just learning your skills academically, but also the life skills that will put you on the right path going forward over the rest of your life seems to be only a reasonable and a healthy thing to do. And so if we can put that into the college years, I think we're doing something that might have a positive cultural change for the whole community going forward.
In fact, in your comment about ADHD medications, if a recent study looking at different drug use and what differences there were between college students and students who were of the same age range but not in college, the only drug that is significantly used more by college students is Adderall, which has to do with trying to focus your attention while studying and so forth. And I can see if we can bring mindfulness-based approaches, that could be a substitute for that.
That's very interesting. I know that mindfulness and acceptance therapies have gathered and amassed some very impressive data in support of efficacy, and I'd like to look at a little bit at that, and just start with ACT, if we could, acceptance commitment therapy. What can you tell us about the usefulness of ACT, both in general and with the college population?
Well, there's several studies that are there. One that I think is especially telling is a study looking at the impact of the book that you mentioned, Get Out of Your Mind and Into Your Life, with college student populations. It was done in a randomized controlled trial with international students who face a lot of stresses because of all the factors that Jackie mentioned that college students face, plus the language and cultural differences that happen when foreign students come to study in the United States. It's a good study because Takamoto, who's the senior author, a Japanese visiting scholar here with us at the University of Nevada, was able to get more than half of all the Japanese students on the entire campus to enroll in this study. And it turned out that if you read Get Out of Your Mind and Into Your Life, it had a significant effect on ameliorating those who are already struggling with anxiety and depression. Quite a large portion of that group, more than half, had clinically significant levels of anxiety and depression. But for those who did not, it also had a protective effect going forward to learn these skills. Learning how to reach young people, I think, is an important part of what we need to do. We know how to reach people who are in distress in the acceptance and mindfulness literature and the ACT work. But we're also trying to learn how to put it into prevention and to reach people before they know they need it. And there, I think we have a lot to learn, but this early study is hopeful to us that if you can get people to read it and to try to apply these processes to their own lives, even people who are not currently distressed can benefit from it. If we're able to overcome that with a face-to-face kind of processes, we may be able to put it actually in the classroom and the first-year experience courses and so forth. And there's a real challenge because a lot of 18-year-olds and so forth still think they've got the world by the tail, and they have not yet learned that some of the things that they may be doing, which may be avoidant and suppressive, for example, are going to blow up on them over time as they face challenges where those coping strategies, as you mentioned, just have a drink or smoking a little weed, et cetera, could actually create long-term problems that then you have to deal with.
One of the things that we've already accomplished in terms of ACT with college students is to show that this is acceptable to college students, even outside of a more typical counseling setting. We conducted first-year experience classes using a standard ACT protocol, pretty much what we would do on a workshop. And when we first proposed it, there were some concerns in terms of human subjects protection, like will this be too dysregulating to students? Can we really do eyes-on with students? And what we found is that and that class was just as acceptable, just as high in satisfaction as a more typical first-year experience class to 732 students. And in fact, that some of the experiential nature of ACT was exactly what students had liked, like the eyes-on exercise. So that's a good first step. We know that this technology can be well received by college students.
And in fact, in that study that is still ongoing, that Jackie and I are working on together along with a number of colleagues, people who are psychologically distressed actually were somewhat more satisfied with an ACT approach to a first-year experience orientation as opposed to a traditional approach. So it suggests that college administrators who are thinking about how they can help the psychological health of students may be able to use perhaps a range of first-year experience classes and maybe target classes for persons who are at risk or in need in a way to give them psychological skills that will be particularly welcome among those who know that they're facing some psychological struggles.
I've been fascinated with the ACT literature that indicates that ACT is really effective in super brief interventions, which I would imagine would be really good news on college campuses where there's so little time available for therapy. And as you were saying, Jackie, the number of actually the sessions you're likely to get is 6 or less. And I was wondering if you could talk a little bit about the research showing ACT's efficacy with these briefer interventions.
Well, I'll speak about it in terms of with college students, and then Steve can chime in because I know it's also been done in other settings like primary care and so forth. But just in my book, there are a few studies that are discussed that I think are highly relevant. Some of the studies have to do with what we call curriculum infusion. That is bringing some content to put it as part of a regular classroom experience. And we've done that with a couple of psychology courses. We've done that with multicultural psychology and also with abnormal psychology, where we went in and created some ACT concepts that were kind of embedded into the class itself, and we found very good findings in terms of acceptability by students in the abnormal psych class and also just impact on people's intentions of behaving differently with students from different racial and ethnic backgrounds.
In the literature writ large, there's a number of studies with pretty short interventions being helpful. I think the message of that it's possible to feel your feelings and to think your thoughts without necessarily becoming entangled with them, and that it doesn't mean there's something wrong with you, or that you're broken or damaged or something if you have thoughts or feelings that are difficult. That could be transformational to people, as well as the idea that you shouldn't put your values and your life on the shelf. That needs to be kept to the fore. And there's an easy kind of thing you can get into, thinking of these psychological stresses as something that has to be solved before you can start living, when in fact it's a cart and horse problem that's almost the exact opposite. People who are engaged in life, connected to what they deeply care about, are building their relationships, are taking time to play, to be involved with others and contribute to the lives of others. I mean, those kinds of things are psychologically empowering to people, and I think in the modern world, sometimes we've focused too much within, waiting for all of our little psychological ducks to get lined up in a row before we can start living. So some of that message can happen, and some of the skills that help you do that can happen very quickly in 3 to 4 or 5 hour protocols. Or right now we're sitting on at least 5 studies looking at internet applications of ACT. There's a similar number of studies, and ones that thankfully New Harbinger has been involved with by helping to support these studies, of looking at self-help books and randomized controlled trials, fairly carefully well-done trials of the impact of these. And so it doesn't even necessarily have to be a relatively short course of therapy. There are other channels through which we can reach people and give them the skills that they need.
And in fact,
go ahead, Jack.
Go ahead, Matt. Do you want me to go? Or?
I was just thinking how liberating it can be for a college student to realize that pain isn't necessarily bad or wrong.
Mm-hmm.
It doesn't have to be suppressed, that the person is not sick or has not screwed up just because there's pain. And that pain can be felt, and we can still go on and live our lives in values-based ways. I mean, I think that message, which can be delivered quickly, is really powerful and transformative. So I just wanted to underscore that. I think it's key and it's compelling.
I agree 100%. These are simple messages that can be kind of go counter to the culture, and that can be really liberating to college students. One of the chapters in my book is about peer mentoring that incorporates the ACT message, and it's a very short intervention, really, with peer mentors. It's 6 hours, 1 hour a week for 6 weeks. And it has shown an incredible impact on the peer mentors. And that ACT message of pain is universal is really one of the things that students resonate the most to. And it's a simple message to communicate. So I agree with you. Also, another chapter in the book is about a values-based intervention that is, I think, would be very intriguing to college administrators, because it's a very simple thing where the students were asked to look at their studies in terms of values and what they care about, and it was done here at University of Nevada, Reno, and Steve is involved in that actually. And what they found is that it improved the psychology majors' grades the next semester. So it's a simple intervention, and it has a very kind of specific impact.
This was a little 10-minute website that just walked you through and asked you to look at what your values were, what really was important to you in your educational experience, and then to define values and distinguish them from goals using concepts from acceptance and commitment therapy. So people really were focused on the quality of what they were doing that had a long extension, not just on their specific academic goals. And then they did some values writing around, why that's meaningful to you and how that shows up. And it was tested against goal setting alone, of just learning to set specific and concrete goals, or in combination with goal setting. And what we found is that the values piece added significantly to goal setting. And in fact, that goal setting alone compared to the wait list was not significantly different. So these are elements drawn directly out of the acceptance and commitment therapy work that you can put into packages that are minutes long that then will have an effect over the next 15 weeks in a very concrete, beneficial way to students of being able to do better academically, which there's some indication that it might even help with retention. So having educational systems can find ways to empower students with healthy messages of acceptance and values focus and accomplish their mission in a more successful way, in addition to improving the lives of students in other ways that will go on, hopefully, for a long time.
I'm struck by this research because it shows how quickly people can change. And I think we, in the mental health business, we tend to assume that any kind of significant behavioral change is going to take a while, but it's a process of slowly rewarding and reinforcing new behaviors and discouraging ones that don't work. But what we're seeing in this literature is that a simple, short, targeted intervention can really make a difference. And I'm just really impressed by that. I wanted to ask another question. One of the chapters in the book that seems very important to me is the chapter on DBT, dialectical behavior therapy, and how it's being used with some of the college students who are struggling the most, who are facing serious emotion dysregulation problems. And I was wondering, Jackie, if you could talk a little bit about the efficacy of DBT with this population and why it's seeming to work so well.
Yes. I mean, we ran what it has been the only randomized control trial with DBT in college students, and we ran it against a very sophisticated control condition. It was actually supervised by what we call, we modeled it after a study done by Linehan and colleagues where they did treatment by experts versus DBT, and what we did is supervision by experts versus supervision by experts in DBT. Because it was a smaller study and we didn't have as much money. But basically we recruited somebody who was nominated by the Nevada Psychological Association and the Board of Psychological Examiners as a borderline personality disorder expert and suicidality expert. And this person supervised the control condition. So we had somebody who was really very well qualified supervising that condition. So even relative to that optimized control condition, DBT showed superiority in terms of reduction of suicidality, depression, non-suicidal self-injury, what we call NSSI, an increase in social adjustment, an increase in global assessment of functioning. And those are, and also we didn't target it, but it was interesting. But we found that DBT was significantly more likely to reduce the number of medications that students were on, even though that was not a specific target of the treatment. The
book also looks at several other mindfulness and acceptance treatments, mindfulness-based cognitive therapy, and mindfulness-based stress reduction, MBSR. And I was wondering if you could say a little bit about how those therapies are being applied to students struggling.
Yes, it's amazing the number of mindfulness-based approaches that are being utilized on college campuses. In addition to the ones you mentioned, there's also mindful learning by Ellen Langer at Harvard, and that is being utilized in a more, typically in a less counseling and more sort of academic context. But one interesting study was done in Australia where ACT and MBCT were actually compared with each other with college students. That's actually one of the first studies that juxtaposes two mindfulness-based approaches, and it was done specifically with college students. They didn't find a whole lot of differences in terms of outcome, but they did seem, their observations seemed to suggest that ACT and MBCT would be recommended to different types of students, because MBCT requires a longer period of mindfulness training on 45 minutes a day on a regular basis, whereas ACT uses mindfulness in a different way. And what they found is that the more typical college student, like the 18-year-old, responded better to ACT, whereas students who were older and in more, like with recurrent depression, were more responsive to MBCT. This was more of a qualitative observation, but it's still, I think, very telling and very useful for us in terms of where to go from here with that.
So we're starting to actually learn. We're starting to actually learn how to match the treatment to patient characteristics, to the students and the kinds of people they are and their developmental stages.
Yeah, there is evidence across the literature, if you just look outside of college students, that the mindfulness, acceptance, and values-based applications are especially good for multi-problem, comorbid kinds of presentations, etc. And so I think this work over time is going to become more sophisticated as we learn how to do smaller things with people with specific problems, bigger things with people with more complex problems. And when you include the full range of methods that are available on the mindfulness and acceptance side, some of them, like comprehensive DBT, can be quite extensive and so forth, and really needed for chronic multi-problem kinds of presentations. And then there's other things all the way down to like the 10-minute values-based web portal that may be something that's very broadly applicable just for empowering people academically. So that's an exciting thing looking ahead, is that we'll be able to match the processes that we provide to the presentations and the problems that we're looking at there. And the mindfulness and acceptance work is going to have a place at the table across a pretty broad range, depending on how we target it.
Also, you were asking how different approaches have been used. MBSR has been used a lot in terms of a brief group format, 8 weeks. At University of Florida, they have a group called Taming Your Anxiety that is based on MBSR, and it's a brief group therapy format, and they've found very high acceptability by students. On the other hand, they screen very carefully the students to participate in the group because of the requirement of daily mindfulness practice. It does seem like the extended mindfulness practice is not for every college student walking through the door, that we might want to start with things that are a little bit less intense.
Yes, so there's a difference between...
Go ahead, Matt.
There's a difference between apparently there's different characteristics of different patients. Some people can handle that kind of commitment, that kind of discipline to engage in mindfulness daily and use that as a Tao, whereas other students are going to have less control over their schedules, over their impulses, and they have a hard time really using a discipline like that. So that may make a difference in terms of what therapy works best for each of these groups.
Exactly. And there are some elements of both MBSR and MBCT that it's like, sometimes they call it the 3-minute break or 5-minute break, where they encourage students to just take 3 or 5 minutes here and there and just sort of be mindful. And that, anecdotally, counselors say works really well with this population. So it's not that the whole approach may not be applicable to college students of a particular age, but that some elements of it might be more fitting for that population.
Well, I just want to thank you both. Mindfulness and Acceptance for Counseling College Students is an important book. It's a book, I think, that has the potential to change and greatly improve our ability to help students who are struggling. And I want to thank you, Dr. Jackie Pistorello, editor of the book, and Dr. Steve Hayes, co-author of several of the chapters and the founder of ACT. I so appreciate you being with us today and helping to really help us understand what mindfulness and acceptance can do to change the suffering on the college campus. Thanks again for being with us today.
Thanks for the opportunity, Matt.
Yeah, thank you so much.